questions for you.
Okay.
What does normal weight loss look like after bariatric surgery?
So normal weight loss after weight loss surgery kind of depends on the operation, but if we want to generalize what the weight loss looks like, it really is pretty rapid in the first 3 to 6 months. So for instance, gastric bypass, what our expectations with the bypass and the weight loss is about 70–75% of their excess weight. That's a number that most patients don't know what it is. So excess weight is the weight that you have from your pre-op BMI or your pre-op weight to a normal BMI, so a normal weight. So for instance, if you're got a BMI of 40, that's about 100 pounds overweight. So that's your excess weight. So our expectation is that in that first year to year and a half, you're going to lose 75 pounds of that 100 pounds. But we're going to lose about 50 of that in the first 3 to 6 months. So it's going to be rapid weight loss in the first 3 to 6 months. Then it's a slower, gradual weight loss till we get to a nadir weight.
Mm-hmm. Good. So patients have a lot of fear about weight loss plateaus when their weight begins to stall on the scale.
Mm-hmm.
Are weight loss plateaus normal after bariatric surgery, or could they be avoided?
So that second 6 months, that's 6 months to a year, and even out to 15 to 18 months for some operations, we do see patients that'll have a plateau. They'll be at the same weight for a week or two, and then they'll drop a few pounds. That's pretty normal. I think if that plateau is extended, you really have to look at your diet and look at what your behaviors are. Those patients that tend to snack a lot more, or that have introduced a little bit more carbs, or introduced some liquid calories, they're going to extend those plateaus. So we really recommend, if you're in an extended plateau, keep a diet journal. Look at exactly what you're eating. Make sure that you're accountable to yourself, and I think you'll break through those stalls.
When a patient experiences a weight loss stall, what do you recommend so that they can keep losing weight? I think you just answered that. Do you have anything to add to that?
No, I think that's right. I think you really, if you're in a stall and it's an extended stall, you think it's a little bit too long, keep a food journal. Be accountable to yourself. Write down everything you've eaten. And if you're really being honest with yourself and you're doing everything right, then get back in to see your provider. Sometimes we have a different insight into what's going on.
Good point. So some new patients are concerned that they'll actually lose too much weight if they have bariatric surgery. What do you say to those patients?
So that's not always, well, that's very rare that a patient will lose too much weight. Usually if I've got a patient that loses too much weight, it's because they developed some type of an eating disorder. So when I mentioned the weight loss that we usually see is about 75% of that excess weight. So that's going from where they are, say a BMI of 40, not necessarily all the way to a BMI of 25. And too much weight would be a BMI in the 19s or the 20s. So it's rare that we'll get a patient all the way through that into an abnormally low BMI or low weight. So most patients get close to a BMI of 25, which is normal. And most patients look pretty normal at that weight. Now, the fact that their family members see them lose weight so rapidly, that's different. That doesn't mean that you're in an unhealthy place. It's just that they're just unused to seeing that kind of a rapid weight loss.
Yeah. So this one's important, I think, for our patients to hear. If we have patients out there that regain their weight and are scared or embarrassed to come back to see their surgeon and their team, what would you like them to know?
I tell you that you shouldn't be. That's what we're here for. You don't have to be ashamed of it. This is a chronic disease, and our goal is to help you manage and treat this disease. So the fact that you've gained some weight and you feel like you can't break through those or can't get back to the weight that you're striving to get to, and you think we're going to yell at you, that's wrong. What we're going to do is we're going to help you identify those things that are preventing you from getting there in a way that you might not understand or you might not know. So that's when you actually need to see us. That's what we're here for.
Mm-hmm. Yep. So here's some questions that our patients actually submitted via Facebook. One says, is it true that you always gain some weight back between 1 and 3 years? This is a gastric bypass patient.
I wouldn't say always. I mean, it's not a lot of always in surgery, but the typical weight loss pattern is we get to a nadir weight, which is the lowest weight, and then there's a little bit of a rebound. And I always tell patients to be expecting that, and it's kind of normal. But I've had patients that get to a nadir weight and just stay there. So it's not always, but most patients do gain a little bit of weight back, but they're able to stabilize the weight at a very healthy place. And that's what our goal is. Once you gain a little bit of that weight back, we want you to stabilize it and try to maintain your weight within a 10-pound range. That gives you a lot more belief that you are in control of the weight, not the weight's in control of you.
Okay, that's good. 4 years out from a gastric bypass, this patient says, I find myself wanting to lose about 20 pounds of regain. Where do I begin?
So 20 pounds is not it's not out of reach. It's a doable weight amount of weight to lose. So a lot of our patients, they'll get back in to see us. They'll get back in to see our dietitians. One of the strategies some of my dietitians will have is using a modified LCD or modified low calorie diet, where you have a patient doing a protein drink for breakfast and lunch, maybe a small meal at dinner. What that does, it takes away some of the choice and also gets rid of the reason why they gain the weight back, which is 90% of the time is snacking and extra carb calories outside of mealtime. So once we start to break through those, those mundane meals and get back to how we're supposed to eat, that kind of helps. If you get about 10 or 15 of those pounds off and then transition back into eating normally, that patient starts to feel better about themselves and they, again, feel in control.
Why do some patients lose weight faster than others? And why do some lose at a much slower pace?
Well, a lot of the pounds of weight loss that people lose differ because of your starting weight. So if I've got a guy that weighs 600 pounds and I've got a woman that weighs 200 pounds, they can't compare the pounds of weight loss. They got to look at their percentage of excess weight, because that 600-pound guy is going to lose a lot of pounds quickly, whereas the female is going to lose percentage, probably the equal percentage, but the pounds will be different. So that's the first thing. But there are patients that lose weight faster than others. And I think some of it's behavioral. Some of it's patients that have not been able to make that transition away from some of the carb calories or the snacking or the eating every 3 hours. So if I've got a patient that says, I'm just hungry all the time, well, then I ask them what are they eating all the time, and they're wanting carbs. So some of those patients with carb addictions really struggle with their weight loss because they struggle with snacking. And I think that's a big key for us in weight loss.
Yep. The last question says, what kind of strategies do you recommend to maintain long-term?
So weight loss surgery really isn't rocket science. We give you an anatomical change. No matter what operation we do, it's an anatomical change that can decrease your portion size at mealtime. And I say this over and over again to my patients. I need you eating at mealtime, using your operation to control your portions. Whenever you start eating outside of mealtime, it's usually mindless eating and it's harder to control. So that patient that I see that's 20 years out from their weight loss operation, that is seeing me every year, that is doing well, is eating breakfast, lunch, and dinner, and they're drinking liquids between meals, and they're very active. Now, it sounds simplistic, but it's actually harder than you think. But that's the key for that long-term success, is really to make the transition away from the snacking or the mindless eating and follow up. And we really know that that patient that does follow up with their providers on a yearly basis and very frequently during those first 2 years has a much better chance of being a long-term success.
Very good. All right. Thank you.
All right. Thank you.